I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Ralph Russo.
From the Associated Press, this is Inside the Outbreak. I'm Ralph Russo. Today is Tuesday, May 12th. Dr. Anthony Fauci has warned Congress that if the country reopens too soon, it will result in needless suffering and death. Fauci was one of several health experts testifying to the Senate Health, Education, Labor, and Pensions Committee via video conference on Tuesday. His testimony comes as President Donald Trump is praising states that are reopening after the prolonged lockdown aimed at controlling the virus spread. A recent review by the Associated Press determined at least 10 of 17 states that did not meet key White House benchmarks for loosening restrictions are opening or planning to do so. Today on Inside the Outbreak, we'll speak with AP medical writer Mike Stobbe, who has been covering the CDC for 15 years, and AP investigative reporter Jason Dearen. Late last week, they broke the story about the White House burying a Centers for Disease Control plan for reopening businesses and public spaces. We'll ask them about where that plan now stands, why it got sidetracked by the Trump administration, and how the CDC has performed during the pandemic overall. What is the relationship between the nation's top disease control experts and the administration? Joining me today on the podcast is AP medical writer Mike Stobbe and Jason Dearen, an investigative reporter for the AP. They've been doing a great job covering the CDC. Thanks very much for coming aboard, gentlemen. I want to get right to the questions. Jason, just to make sure the listeners are up to speed, what was in the CDC document titled Guidance for Implementing the Opening Up America Again Framework?
Right. Well, thanks for having me. I think, as the title reflects, what this is a document that was meant to help communities make decisions as they reopen different aspects of society, from mass transit, schools, daycare centers, and lots of other types of facilities. So it was a detailed document, 63 pages in total, that had decision trees meant to help people. So if you own a daycare center, for example, you would have a decision tree that would take you step by step through different scenarios you need to reflect on as you make decisions about whether you should reopen or not. So it was a detailed set of instructions.
And Mike, what happened to the document? How did it come to get sort of stuck in, limbo at a time when states were actually planning to reopen businesses and public places?
Yeah, well, the documents went up to Washington in April. The CDC, the scientists and other professionals at the CDC put them together, sent them to Washington. They expected to get a green light and to get them posted on a government website so the states could see them and use them. We got a copy of the document and reported on it in late April when it was still being reviewed, but was expected to be posted. But it wasn't posted. Last week, AP learned the administration had decided to shelve it. Sources used the phrase, quote, "will never see the light of day" in describing its status. Why not? In our initial reporting, a person close to the White House's coronavirus task force said the CDC documents were never cleared by CDC leadership for public release. That proved to be incorrect. Jason can tell you more about that. But the person said the White House officials had refrained from offering detailed guidance for how specific entities should reopen because it was affecting various parts of the country differently. People I talked to at CDC said they never got an exact reason why it was being shelved, but there seems to be other concerns, and one of them involves religion. The guidelines called for limiting exposure to people by holding virtual services, to keep gathering sizes down, keep people at least 6 feet from each other in the pews. It's been reported there have been some large churches in some parts of the country that have defied the entreaties of public officials to cancel large services and gatherings. And we heard that one of the holdups, one of the things that have been held back is information regarding religious facilities.
Jason, Mike mentioned some subsequent reporting here, so let's go to that question first. And in some of that subsequent reporting, there was even more details that were found in a trove of email communication you obtained between CDC and the White House. What did we learn from there, which may have provided shed a little more light on whether or not the CDC had actually approved this?
Right. So after our initial report, the White House said, as Mike reported, that CDC itself hadn't cleared these, so they wouldn't, clear them before CDC had. What the new emails that we obtained showed that was as early as April 10th, the director of CDC, Dr. Robert Redfield, had emailed a finished version from CDC for review to the White House task force, as well as advisors very close to the president, Jared Kushner, Kellyanne Conway, Joe Grogan, the OMB, which is the Office of Management and Budget, and OIRA, another regulatory office. And this is usually done when CDC itself has cleared something for review. So it's come out of the agency. The agency has said, okay, now we want to get this up on the website. Redfield himself in the emails from April 10th to April 24 had sent multiple emails saying, we want to post these. We want to get them approved, as well as CDC's chief of staff. He also had emailed inquiring after April 24th. The emails then show that on April 30th, there was a strict order from Washington to CDC not to post any of them. That's when they were officially declared dead and when they were told they would never see the light of day. The next day, on May 1st, one of the staffers who was coordinating the writing and editing of these documents was quoted in an email as saying that the effort, that they were standing down, that the effort wasn't happening. There was no chatter after that until our story hit May 7th. After that, my sources inside CDC told me they received a call hours after our story moved saying that these had been shelved, ordering them to revive certain aspects of the longer reports so they could get them back in the pipeline and try to get them out.
So, Mike, has there been any explanation from the White House, or is it simply this now suddenly is now seeing some light as opposed to before?
They've said different things, and I don't know. I haven't. I'm not clear on what the explanation is, where things stand as of yesterday.
Gotcha. Let me ask you this, Jason. It's sort of a big picture question on the CDC and the administration and their relationship, not just with this incident, but sort of throughout this health crisis. Could you describe the relationship between CDC and the administration?
Sidelined, I think, is the word we've used, which is itself a striking change from previous outbreaks or pandemics that the country has responded to. If you look back as far as 2009 during the swine flu pandemic, CDC was a leading public voice on the U.S. response to that. They, as they usually do, published guidance on a regular clip because as pandemics and outbreaks change and they learn more, they update guidance to help doctors and public leaders make decisions on how to respond on the local level. That's what CDC's role is. And so if you look back at previous outbreaks in the country, they're usually the face of the public response. And that's what's been so striking during this unprecedented pandemic is that CDC has been sidelined since February, when it had a pretty significant misstep in creating a diagnostic test. The kits that it sent out had problems, and that really kind of hamstrung early efforts to get the nation's arms around this problem. But since then, they've continued working and creating guidance. I mean, there's thousands of people who work at CDC, experts who can and work on many different aspects of this, but have not been at the forefront. So while they have created some guidance, a lot of that has been slow to be updated, and including the ones that we reported on last week, some have been shelved completely, and have not seen the light of day.
I think Jason summarized that very well. I might add a couple things. As he mentioned that, right, there was a problem with the test kit that the CDC developed and was supposed to send out to the state labs. It was flawed and it slowed everything down for weeks. One of the things that was also slow to get going was a surveillance system where the CDC was going to work with officials in certain cities and states to test a wide array of people with flu-like symptoms to see if coronavirus was more widespread in people than was assumed at the time. Spoiler alert, it was. And the CDC also seemed to fall behind some data people at Johns Hopkins University in posting case counts. So the CDC didn't seem to be on its game as much as it has in other outbreaks. But I think equally important, the CDC at the time also maintained itself as a voice of science, and one that at times contradicted the message coming out of Washington. This has been reported before, but you can recall that in February, President Trump and others in the administration were saying that the situation was under control, the virus was contained. But in late February, a CDC official named Dr. Nancy Messonnier, who was leading the CDC response, said in a press call that no, to the contrary, things are getting worse. And she said, for example, that if you're a parent, you need to start asking hard questions about what is our family going to do if they close the schools, things like that. I mean, you have to go back in the time machine with me, but in mid-late February, the idea that the virus would cause schools to close was still a little shocking. The stock market went down, and Trump reportedly was furious. And it was not long after that that the White House task force became the entity holding the press conferences. And Vice President Mike Pence was put in charge and began more closely controlling communications out of the CDC. Messonnier and other CDC voices we've become accustomed to hearing grew silent. As Jason said, the guidance that we expect to see from CDC was reportedly shelved or altered or delayed. And you have situations where Trump and Pence have, personally defied CDC guidance, for example, in wearing masks. They haven't worn them at press conferences and in instances like a visit to a hospital and a meeting with elderly military veterans.
Mike Stobbe is an AP medical writer. Jason Dearen is an investigative reporter for the AP. They have done great work over the last week or so covering the CDC and the relationship between the CDC and the White House and what happened to a document with a lot of detailed plans on reopening the country that ended up getting buried. It apparently now will see the light of day, though actually, before I let you guys go, one last question. This document still has not been produced or put out to the public, right?
Yeah, so Mike and I published with our first story a portion of the larger document that had been leaked to AP or given to AP previously, and that included these decision trees that I described earlier, as well as some other kind of details. It turns out that was the kind of latter half of the overall document. It was about a third of the total.
Mike Stobbe is an AP medical writer. Jason Dearen is an investigative reporter for the AP. Thanks very much for coming aboard, gentlemen. Please stay healthy and stay safe.
Thank you very much.
At apnews.com, today's One Good Thing feature is a story about a baseball writer with no baseball to write about. Chris Cotillo covers the Red Sox for MassLive.com. To help those affected by the coronavirus pandemic, he began auctioning off signed baseball cards and pictures he collected as a teen. In less than a month, he sold more than 300 items and raised over $50,000. Inspired by him, others on the Boston sports scene have brought that total to close to $100,000. You can read that story and all of AP's coronavirus outbreak coverage at apnews.com.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com. From the Westwood One Podcast Network.